is really possibly the strongest indicator that gender matters. In the Irish context, mine and my research with Sarah Sheridan published a number of years back, just to give a couple of statistics, 72% had experienced violence or abuse during childhood. Over 90% had experienced violence or abuse in their lifetime, and 2/3 reported intimate partner violence. Now, these kind of factors that are related to relationship, family issues, there are other reasons. And of course, we know this, and these are related to economic and housing problems, and the housing market, which is really the dominant explanation for our increase in family homelessness. But there are important gender dimensions to these kinds of housing stress and housing instability. For example, we know that family homelessness is highly gendered, disproportionately experienced by households headed by a single female. And this is very much the case also in Ireland. A very high proportion of the families that we're seeing coming into homelessness and remaining in homelessness are female-headed lone parent households. And also to mention that alongside, there is evidence of a diversification in the profile of homeless people across Europe. For example, we're seeing a lot more migrants featuring within homeless populations. And we know that alongside this, there is evidence of increased susceptibility to housing exclusion, housing stress among women in particular. Now, just to say a few things about women's journeys, and because we haven't followed women through research effectively, you know, this is at an international level, we don't know as much about how actually women move through the homeless service system, and we know particularly little about their exits. But there are a few things that we can say about women and about some of these distinguishing features that relate very particularly to gender. And one of these relates to women's tendency to rely on informal networks, certainly at the early stages of their homelessness. So what this means is that women, when they first experience homelessness, they will not necessarily present to services, and therefore they're not enumerated. Alongside that, there is a tendency for women then to live in situations of hidden homelessness, and this is undoubtedly related to the particularly strong stigma attached to what Ward Howe more than 20 years ago referred to as the unaccommodated woman. So people are uncomfortable about the notion that women and their children are homeless, and it's not discussed at the level or that one would expect in societies by and large. We do also know that women delay leaving abusive home situations because the alternative is homelessness. So effectively, women may find themselves in a situation where they're basically choosing between domestic violence and homelessness. And there is also evidence of women, very strong evidence in Ireland of women seeking informal solutions. So in other words, they're in the shelter system, but they leave because they don't want to remain in the shelter system, often related to stigma, but also related to fear and anxiety, particularly anxiety about their children. They exit the system, but they ultimately come back into the service system because these situations are not sustainable into the future. So we have reasonable evidence, and it's very strong evidence in the Irish context, of women remaining or cycling constantly through the system so that they're not exiting. And I'll just refer very briefly here to the findings of Sarah Sheridan's PhD research. She tracked the original 60 women that we originally recruited into the study, and she managed to successfully track 49, and of these only 20 had exited homelessness to stable housing after a 3-year period. this is a really low level of exiting. These women, particularly single women, experienced multiple barriers of access to housing. And now when I say single women, I'm talking about women who are presenting to homelessness service as a single person, but in fact a large proportion of these women are mothers and their children living elsewhere. We did find that women with children in their care were more likely to exit. So what we see here is evidence of conditionality of access. And much of this conditionality is based on deep-rooted assumptions about family, femininity, and motherhood, with, as I said, women who are single, far less likely to exit the homeless service system. And finally, there's evidence that long-term homelessness is in fact far more common among women than is routinely recognised. So finally, just to say a little bit about service responses. Well, there's huge variation throughout Europe in the terms of the nature and range of services available to women. But what we do know for certain is that shelter or hostel type accommodation it remains the dominant response. So what we have essentially is a continued reliance on institutional responses to women's homelessness. This has a historic context. We know this to be very strongly the case in terms of historical responses to women who were perceived as quote unquote deviant or falling out of the mainstream of what was considered to be expected of women in terms of their place and role, particularly in the family home. And importantly, of course, since the introduction of homeless family hubs, these predominantly house mothers and their children, and this is very definitely a transitional, congregate, institutional response. Housing First for women is very underdeveloped, both in Ireland and internationally, with very little discussion of gender within Housing First discourses. And also importantly, what there's strong evidence of, not just in Ireland, but in other countries, is a disconnect between homelessness and domestic violence services. So just some concluding remarks. I'm happy to take questions or queries later in the seminar. Homelessness is not gender neutral. Women's homelessness does have distinctive features. If women's homelessness is different, which doesn't mean that all aspects of it are different. There can be similarities between dimensions of the homeless experience across genders, but it follows nonetheless that we need specific responses, and these responses must come from strong policy input and policy directives. It's certainly clear that services that are modelled on the male experience won't serve women well and may lead to further marginalisation. And these services may also inadvertently serve to maintain women in homelessness and contribute to ongoing cycles of housing instability. And finally, I think that the role of gender-based violence in women becoming homeless, and its role also in maintaining women in homelessness, the lack of adequate provision of shelter, refuge, accommodation, and I'm referring there directly to domestic violence, refuge, accommodation. That issue needs urgent attention, as does the whole area of collaboration between homeless and domestic violence services. So I'll leave it there. Thank you for listening.
Thanks, Paula. That's a whistle stop with a very comprehensive review of a lot of the issues. So I would encourage people to start posting your questions as you think of them, and so we'll have them there. So our next speaker is Teresa McCarthy, who is a support project worker in Cork Simon for almost 10 years. She's working currently in Gateway, which is a stabilisation project within Cork Simon, and she's been part of the needs of women in homelessness group since 2015 when it started, and has participated in some of in the Erasmus project around learning about women's experience of homelessness and how we can better provide services. So I'm going to hand over to Teresa straight away.
Hi, and welcome to the Simon Communities of Ireland seminar. 2020. So as Wayne said, my name is Teresa McCarthy and I'm currently working in the Cork Simon community. But I suppose more importantly for today's purpose, I'm a member of the Simon Communities of Ireland's Needs of Women in Services Working Group since its beginning in 2015. So I'm quite thankful to be part of it from its onset. And I suppose to echo what Paula has been speaking of in relation to women, the Simon communities, we're a mixed service, so we're not specifying that women experience these issues and men don't. It's just our working group focuses on women's needs and services. So just to clarify that we're not neglecting the men, but our purpose is to discuss the women. So the core objectives of our working group would include to develop and improvise understanding and awareness across all Simon communities of best practice in the meeting of needs of women in services, to develop policies in relation to domestic violence, safe spaces, trauma-informed practices, coercion awareness, and so on. And they have the inclusion of a women-specific strategy to be included in all Simon communities of Ireland's strategic plans. So just to give a little overview of the Erasmus programme, we received funding, in 2018 to be part of this partnership, which there are 6 joint meetings over 1.5 years. And each meeting explores a different theme related to meeting the specific needs of women assessing homeless services. These themes include children, health, trauma and safety, couples, and women's participation. Currently, our coordinator for the Simon Communities of Ireland's partnership would be Joan Reinhardt, working out of Galway. So this presentation will share some of our key learning and resources from the working group to date. So as part of the programme, there are 8 core countries, including Hungary, Poland, Denmark, Ireland, Slovenia, Belgium, the UK, and Finland. And we also have guest countries which participate depending on the topic of the particular meeting and if it's an area of their practice. So each participating partner will prepare and share their learning and best practice from their country on the topic in relation to homeless women. The focus is on women-specific services related to each specific team. And the information in the group is shared via G Drive, email, online meetings, and dissemination is nationally via various means like this webinar and Simon Communities of Ireland's National Conference. And just to backtrack, there is a link to the Erasmus project page. They're highlighted in blue at the bottom. So some of the key themes of the Erasmus programme. So the joint workshops explored in 2019 to 2020 have been children and how best to support women who are supporting their children through homelessness and supporting women who have been separated from their children. Health, which is looking at all aspects of women's physical and mental and emotional health. And safety, which is creating non-threatening environments for women to try to avoid re-traumatization through the use of services. Now, as everything else, COVID has put a pause on our project for the moment, so our upcoming partnerships are going to be next year by the looks of it. We are currently holding online meetings at the moment, so other themes that we are yet to explore would be women's participation, which would be giving women their voice back and empowering them to help shape services that meet their specific needs. And domestic violence and working with couples and services and best practice in relation to doing that. So some of the key learning we've observed from the women and health topic would be the emphasis on bringing awareness to and acknowledging to mental well-being and the need for resourced services to address and support women with mental health disorders and emotional trauma, which is currently unavailable to many homeless women. Life skills training for the promotion of optimal physical care, services to take an active role in sexual health promotion, the provision of free access to sanitary and personal care items, make them readily available instead of people having to come and ask, and a collaborative wraparound support to address trauma and related substance misuse, and the need for active interagency collaboration on dual diagnosis. The key learning on the theme women and safety would be trauma-informed practice. So which was identified from the ACE study, women-only spaces is vital to avoid re-traumatization of women. The lack of capacity, female beds and placement in the current system, It's difficult to count female rough sleepers due to locations that they use. There's many women stuck in hidden homeless. The provision of private spaces, so for example, single occupancy bedrooms and private bathrooms, which would be key to reducing re-traumatization within the homeless services. And individual quiet spaces in shared residential settings, and resource provision of secure storage of personal belongings while homeless, that it's not time limited. So just to give a little quote from a service user who is currently in the Midlands Simon community in their supported living accommodation. So she said that she feels very safe. It's nothing like her last place where I had unwanted visitors calling to the door. Here the neighbours mind their own business and there is security having the gate with code and buzzer downstairs. I forgot to lock my door one night and woke up shocked that no one came in and I could trust people around me. It makes me feel secure and sheltered, more well looked after and protected. I did not have an outdoor space in my last place, and having my balcony and flowers makes me feel closer to nature, which makes me feel safe. I think it's a perfect example of what the sense of security will do to someone's recovery and their move on then from homelessness. It's vital for them to have that sense of security in their home. So the key learning on women and children would be how vital policy changes. The current homeless policy can act as a barrier to reunification. So for example, the single occupancy allocations to women whose children are in care, it doesn't really provide for women who are fighting for access back of their children. It doesn't provide them a safe space to have visiting rights, and it's not appropriate. They need to be able to have double occupancy allocations. So the advocacy at regional and national level for parents to be allocated tenancies that are conducive to access, safe visitation, and ultimately reunification with their children, and bereavement, raising awareness of the impact of separation and loss. So finally, just to summarize on the key learning of the shared experience through the European Working Group, has been the greater understanding of the effects of trauma on the brain and how that affects women, people in homeless in general, but women are 4 times higher in relation to the general population. Access to best practice across Europe and implementation of this in our services. Recognition of what we are already doing well in our Simon communities of Ireland. So for example, the provision of women-only services, providing women-only spaces in mixed services, services with individual bedrooms and bathrooms, the focus on women's health issues as being very different from men, active women's feedback and input forums, and developing policies on domestic violence for homeless services, to focus on mental well-being as crucial to positive outcomes for those exiting homelessness, and training staff in trauma-informed service delivery. For example, trying to eliminate the 3 strikes and you're out approach. So that's it for me. Thank you. And sorry I wasn't able to share it in the full screen. My laptop is working against me. So thank you.
Thanks very much, Teresa. That's really useful, and it's good to get the sort of the practical side as well. It kind of leads us neatly into Fiona, who, without further ado, Fiona Ryan is the Chief Executive of SONUS Domestic Violence Charity, which provides frontline services to women and children experiencing domestic abuse across the Greater Dublin region. Previous posts include the CEO of the public health organisation Alcohol Action Ireland and advocacy campaigns manager with the children's charity Bernardo's. I'm going to hand over to Fiona, who's going to talk about the experience of SONUS, particularly on domestic violence, and I think might respond as well to the other two.
Thanks so much, Wayne, and thanks so much to Paula and Teresa. They've given me a very easy job to do. Their presentations were excellent. In actual fact, they raised a lot of the key points that we would encounter. I suppose in order to contextualize my reflections on Teresa and Paula's presentations, it's probably worth telling you a little bit about SONUS, who we are and what we do. SONUS has been around for 25 years. We are the largest frontline support services organisation to victims of domestic abuse in the country, but we operate primarily in the Greater Dublin region. We provide a range of services, including emergency refuge, safe homes in the community, advice and outreach, court accompaniment, And we also advocate at national level. So we would be on the monitoring committee for the National Domestic, Sexual and Gender-Based Violence Strategy, as well as a number of other policy making fora. Probably what makes us particularly useful in this conversation is that we didn't begin ostensibly as a domestic violence organization per se. We began as a homeless and housing organization for women who were vulnerable, women and children who were vulnerable primarily because of domestic and gender-based violence. And because of that, we've always, I suppose, kept an eye on both our domestic violence sector and obviously the homeless sector. In terms of my own role, I'm here 7 years, and I guess, you know, it's funny, listening to Paula has made me think that there are the beginnings of a sea change in terms of how women's experience of homelessness and also women's experience of domestic violence and the context of homelessness, how that's starting to be understood. I'm going to speak very frankly, and it's very much based on a subjective experience, but I think it's very much supported by what Paula's findings are in her own research. When I started 7 years ago in Sunnis, there was a very low appreciation, I think, particularly in the housing homeless sector, in terms of a gendered analysis of homelessness. And I would frequently have to deal with being, you know, arguments talking about equality and that we don't discuss gender because we believe in equality. And I mean, if we just hold that sentence, we don't discuss gender because we believe in equality. It always struck me as particularly bizarre, but when you actually go to national homeless policy, effectively women, gender, domestic violence and gender-based violence feature almost nowhere in the national strategy. And there's a great saying in business, you know, what gets measured gets managed. And I think the fact that what gets recognized gets understood, and the fact that none of that actually exists starts at first principles in terms of cascading down to a low systemic awareness of gender in the context of homelessness. But I would go so far as to say at times a hostility to that understanding of gender and homelessness. I don't know if it's unique to homeless services. I would have said there was an element of it in public health, although perhaps they're further ahead. But I do know when I worked in Brussels on and off for 5 years in public health, I would have a number of European officials come up and ask me, what is it about Ireland and gender? Why do we engage so little with the idea of gender? And yet you have to ask, and I think it goes back to Paula's context about conditionalities, that there is fundamentally an assumption around women and gender and homelessness and our position in society based on family, femininity and motherhood, and that there is an unrecognized norm that is that homelessness is male. And often when, I mean, I think it was Gramsci, you talked about the exercise of power, that what's not questioned is often the most entrenched power relationship. So, bringing that all back to brass tacks, Sunnis, as I said, is on the front line. So we engage with women who are homeless as a result of domestic violence, but also who are experiencing domestic violence while homeless. I need to, I think at this point, make a very clear differentiation, because it's been said to me on a number of occasions, well, I mean, we're talking about relationship breakdown. We're not talking about relationship breakdown. Lots of people have bad relationships. Lots of relationships break down. Domestic abuse is different to relationship breakdown. Relationship breakdown can be the result of domestic abuse, but domestic abuse is a patterned behavior by a perpetrator characterized by control and abuse of another person. It can be psychological, physical, financial, sexual, but it is different to relationship breakdown. So our experiences are as follows, and to bring these experiences to you, I went out again and engaged with our frontline teams and said, okay, talk to me what's really happening out here. And the reality is that women, domestic violence and homelessness are inextricably linked. From the moment a woman considers leaving an abusive relationship, she often has to engage with the fear of homelessness for her and her children. And we know from the women and kids that we work with that particularly for women who are mothers, that fear of homelessness has kept them in abusive relationships and put them at increased risk. Now, in terms of COVID-19, you know, it's been a lot of talk about, well, COVID-19 increased domestic abuse. And COVID-19 certainly increased risks for a certain category of victim of domestic abuse. And to put that risk into perspective, we literally had women driven into the gates of refuge who were by Gardaí who were at such high risk. We had women whom we were supporting who've been strangled while they were pregnant during COVID-19. What we're seeing perhaps is a higher reporting rate as women have been literally imprisoned in the same space with their abusers. And the reality is they are coming to us and they are often exiting to homeless services. So we know homelessness is delaying them actually seeking help and fear of homelessness. And then while they are being supported by us, they are exiting to homeless services. Their experience of homeless services, and I've been told that I need to move on here quickly, their experience of homeless services can differ significantly versus whether they're a mom or a single woman. And that again goes back to Paula's points. And I think the whole, you know, the points that Teresa made regarding that whole adverse childhood experience, we do see that with our client base. But the reality is that in terms of homelessness, particularly that domestic violence doesn't cease when you leave an abusive relationship. Homelessness and domestic violence still carries on while someone is homeless. And we've women telling us that they're literally being hunted and stalked while they're in homeless services, feeling unable to confide, because the reality is there is so much shame attached to being a victim of domestic abuse. It is very hard for women to disclose their experiences to local authorities. And the barrage of information seeking they have to go through often means they don't disclose, and that has led in the past to local authorities and others confusing prevalence of domestic abuse with presentation. For example, we were frequently told, but actually very few women present to us with domestic abuse, and yet we know that a minimum of like 1 in 4 women in Ireland will experience domestic abuse through their lives. So where's the gap? Where's the dichotomy? So I suppose to sum up, I think Paula and Teresa very much nailed what we would see at a practice level working with victims of domestic abuse who are coming from homelessness and leaving to go to homelessness, official homelessness and hidden homelessness. I think there are signs of hope in terms of that service engagement and that service interface. And we've noticed over the last 6 months that we've gotten a lot more requests to provide training to homeless services around the issue of domestic abuse. We're the, I guess, partner for the HSE in terms of delivering their training. So it's really gratifying that homeless services and other agencies are reaching out now to say, okay, how can we increase our awareness? How can we increase our support? Thanks.
Thanks for that, Fiona and Paula and Teresa. I think it's been it's really good to get such passionate advocates for on an important topic that doesn't get, I think, discussed enough. So I'm going to ask people to, if they can, I think there's a Q&A section if you want to put their questions in there or into the chat, and I will ask them as we go. But I'm going to use my my position as chair to ask the first question. And I suppose sort of in a more generalized way, what do we think are the has been the real impact of or what could be the benefit of the gendered analysis? So sort of what we talk about, you know, we tend to have this focus on men's homelessness, and the services are designed for that, so they're not designed for women, and that clearly has an impact. But I wonder, how could that be improved? Teresa has talked about some of the ways that already services are starting to adjust, but I just wonder what more we could be doing, and how can a gendered analysis help us to do better, and whether there's other aspects of prevention or support to move on that we should be looking at in the gendered analysis as well. Yeah, So I'll go to Fiona and then Paul, if that's okay.
I think it's a great question, Wayne, and certainly one that I could never understand, wasn't engaged with more, from the perspective that even regardless of having a gendered analysis, or whether that's a political reason or not, for sheer pragmatic reasons, if gender and gender-based violence is a reason why you have an increase in family homelessness, surely in terms of sheer efficiency and resource allocation, you would seek to engage with that in order to optimize your interventions. But I think a lot of it goes back to the fact that, one, we don't have a national homeless policy that recognizes the interface of gender-based violence and domestic violence and sexual violence with homelessness as a causality of homelessness. And secondly, you have a very siloed departmental analysis. So for example, Paula would have referenced the lack of, say, available refuge spaces. We know that under the Istanbul Convention, which we're signed up to, and which we're supposed to ratify, that we are short like hundreds of places for women and kids. So that even short-term emergency intervention is missing. So I guess the reality is that if we do want better interventions, if we do want to lift more families out of homelessness, then we need to start engaging with our first principles. We need to find a way for national homeless policy to interact and interface with the National Domestic Section Gender-Based Violence Strategy. And we know at the moment under the Programme for Government that there is a review due of that strategy. And I think it's a great opportunity there to make an intervention at that level and then have a cascade down to the appropriate agencies.
Paula, do you want to?
Yeah, I think obviously most people would agree that a gendered analysis of any social problem is important. And in any context, whether it's related to homelessness, whether it's related to drug use, problem drug use, drug treatment, all of these kind of problems that can be quite intractable. And that to assume that women's and men's experiences of any of these issues are just the same is inadequate. So it needs to go up to the top of the policy agenda. So we have multiple homelessness strategies that over the years, probably more than any other European country, but they don't reference women specifically. If women are mentioned, they're mentioned in a very fleeting way. So there's a lack of differentiation between different categories or groups at policy level. So we need to start to get that right, would be my view. And it's not just related to the issue of domestic violence. We do know that structural factors related to the housing market is the biggest driver at the moment of women's homelessness, our family homelessness, which is essentially primarily women's homelessness. But there's been a failure to realise the specific dimensions of a housing market that impact women so profoundly. And here we're talking about women living in poverty, and they are affected at a higher rate and more dramatically than other categories. And we see this very clearly, but I feel that there's been a failure to engage with that.
Okay, it's really useful. And Teresa, I suppose I'd shift the question slightly to you, just looking at the experience of the working group, looking at how it's made you reflect on the services that the Simon communities provide for women and how we provide them. I'm just wondering where you see the continuation of that work going and how it's how has it helped you to develop the services and understand the services better, and also what's the trajectory of it, do you feel?
So I think it's been really evident how important it is. I suppose, first of all, policy, domestic violence policy, I suppose it's something that we're developing as a direct result of the group. It's because we're a mixed service, mainly around the Simon communities of Ireland, it's our first and foremost priority is homelessness. And then you have amongst that so much, you've mental health, you've addiction, there's just so much under the umbrella of. So I suppose the good thing about the group was we were able to pinpoint the factors relating to women specifically. Domestic violence was a huge one. Then we identified the importance of women-only spaces. Now this is already in some of the Simon communities of Ireland. In Cork, we're starting to work on it as well. So it's really important to have women-only spaces. The women's need to feel safe and secure is massive. I think if you're someone who is experiencing domestic violence, if you're leaving a dangerous situation, you need to also feel safe into the situation you're stepping into. If that's a mixed hostel, which most of the time you might have to present to the shelter, are you going to feel safe in that situation as well? So we're really trying to push through the need to have women-only shelters, women-only spaces, just for that sense of security for them to actually move on in a really positive way. So yeah, the developing of policies in relation to that would have been huge. I suppose it's interesting to see throughout the program how each country, we're all experiencing very similar things, and that's lack of funding, lack of government policy, lack of awareness around women-only issues. So it's really interesting to see that we're not alone in Ireland. It's across Europe. And I suppose it's been really interesting to see Helsinki in Finland, for example. I suppose they're the model of the Housing First initiative, which we would be kind of following suit. And it's really amazing to see what they've done, where they really have nearly eradicated homeless shelters and emergency services. They've got so many people housed in individual independent living. It's really amazing. So I suppose that's what we would be very much aspiring to would be to get to that point where we don't need these emergency hostels anymore. We don't need, but it really does come down to a lack of funding. I suppose there's such a lack of the services that are there for domestic violence is amazing, but we need more. We need a lot more spaces for people to go to, whether it's just a woman or family. And I suppose separating the woman from her children, then that's traumatizing on the children as well as traumatizing on the woman. It's really just causing more trauma on top of. So I think it's very easy to see why somebody would stay in an unsafe situation, because they're facing into so many more unknowns when they leave. It's a very scary time, and we really do need a lot more funding, I think, behind, and that has to come from the top.
Thank you, Tracy. That's I suppose that's a really interesting sort of. We've covered a lot of ground on that, and I just wonder actually on the broader question that Paula raised. Sorry, I do have a question here from the floor, which is Teresa, just about further information on the working group, and I think you put up a slide where you showed the link to information on that working group and the Erasmus project, and I think we can send around some of the slides to the participants, so people will have access to that. Okay, there's a question here, and there was a question about the abortion referendum and whether it's had any impact on women in homeless services, and if so, is it for better or worse? I don't know if anyone wants to.
I suppose from my perspective, we're not seeing a massive impact yet. As of yet, it's not to say that it hasn't had an impact, but I suppose it hasn't been identified as of yet, anyway, from my perspective.
I'm conscious of time, and we did promise people that we would stick quite strictly to the 45 minutes so that we can hold people. I'd be interested if anybody wanted to contact us about further questions. We're happy to follow up, and you can do. Sorry, Fiona wants to come in there too.
Sorry, I just noticed there's a question from Sinead, Dr. Sinead O'Malley. Is that right? Saying, I wonder if there's any movement on better supporting women homeowners to be given accommodation in domestic violence services. Wayne, you're on mute. You're on mute.
Sorry, it's all falling apart. So she said her experience in Galway is that homeowners could not be supported in domestic violence services, and she wasn't sure if this was a national issue. I don't know if Paul, if you've come across that in your research, or Teresa, you might be able to tell us what your experience in Cork is.
She said DV services, Wayne.
Apologies. Okay, Fiona.
That's not our experience, Sinead, here in Dublin. In fact, SONUS would support, while we have a lot of demographic diversity, some of the highest risk cases we've actually engaged with have been those of homeowners, because often, as you can imagine, for various reasons, they may be reluctant to leave. We support women and children and women who are obviously homeowners. One of the challenges around women who are homeowners is obviously, and where there's an equal share, is around barring orders, but also accessing rent supplement. And there's some very welcome news in the last couple of months. The national network of which we're also a member, Safe Ireland, worked very closely with the department, because we call them DEASP, to secure rent allowance for women who would not necessarily ordinarily qualify for that. And so that's going through the system at the moment. And what it will do is basically, hopefully, ensure that women who ostensibly look like they have the income, but may not necessarily have it, because we know of reasons financial coercion is part of the coercive control pattern, and they'll be able to get rent allowance as well. But from our perspective, we don't make a difference between supporting women who are homeowners or not. The issue may be, Sinead, were it actually for them to access social housing. That may be more of an issue, and that's more something to do with the local authorities, which we do advocate on behalf of. Is that okay?
Thanks for that. Yeah, she got back. Excellent. Thanks for that, Fiona, and thanks everybody. I'm conscious we've now run 5 minutes over time, and I'm under strict orders to keep time, which I've already passed over. So just to say thank you to our 3 speakers, to Fiona, to Paula, and to Teresa, for a really interesting and informative discussion. And thank you to everybody who attended today. We hope to do more of these into the future, so you'll be hearing from us. And with that, we shall wrap up. Thank you all very much.
Thank you.
Thank you.